My client has chest wall pain, and he's aware of a sensation of being asymmetrical in his upper thoracic spine and rib cage. And this is an isolated finding with respect to the right sternoclavicular joint. And what we find is that the clavicle is prominent, meaning more forward on the right side. Seems to be fairly symmetrical in terms of being vertical, in terms of the vertical alignment. But more important than how something looks is, does it move normally? And it might be that he developed this way, or it might be in response to his injury. And I can get good spring mobility in a anterior to posterior direction on the left. And on the right side, there is blocked mobility. And so that is an abnormal finding. It goes beyond position. Now I tested his AC joint mobility, and that mobility is good. And underneath that is the first rib connecting underneath the clavicle. And I've tested his first rib mobility, and that mobility is good. And I've tested it in the transverse plane, and I've tested it superiorly, and I've tested it inferiorly as well. And all of those motions are normal. And so what I'm going to do is I'm going to distract his scapula laterally, and that will pull the clavicle laterally, and then I will push posterior and laterally. Now another motion that we should test is, does it spring laterally towards the acromion? And the answer is no. That is blocked mobility. Does it spring medially along the plane of the clavicle? And the answer is no. That has blocked mobility. And so when we test this side, there is definite joint play. I can definitely spring the left clavicle along the plane of the clavicle medially, and I can definitely spring it laterally. So the technique I'm going to use to try to restore anterior to posterior mobility of the medial clavicle is that I will grab his shoulder blade and distract, capturing the acromion here, which is top of the shoulder blade where it connects to the clavicle. That's called the acromioclavicular joint or AC joint. Then I'm going to distract that laterally for a couple of minutes, and then I'll keep pressure on the acromion, and then I'll come capture clavicle, and I'll push it posteriorly, and I'll push it laterally as well. So I'll stop filming now, and then after the treatment we'll come and film the results. It's such an unusual restriction. The AC joint is much more prone to mild displacements and mild hypomobilities, much more so than the sternoclavicular joint.